We're good.
Struck by, the ability of little pieces of paper to cause stress and make people talk really thank you for that, Rachel. One of the things I will say before our next speakers are ready is it connects back to the conversation I mentioned yesterday with Maria a few years ago. We actually do know what the solutions are. That a number of years ago it was about, well, we don't know this, we don't know. Yeah, actually we do. And there are these examples and many others across this country would say, yeah, it's not about we don't know anymore. The complex issue then is how to go about implementing these things broadly across the country because they do work. As much as that means there's still a lot of work to do, it's a much healthier place, I think, for us to be. So, on that note, I'm going to welcome our final speakers who are going to co-present. So we have two people talking really fast. Narelle Clay and Michael Coffey, who are the Congress speakers who have the distinction of having traveled furthest. Jet lag, they've dealt with very well. I think they're well used to it at this point. I met them last year in Washington, and they seem to roll with it. Will share with us the experiences and successes to date regarding homelessness among young people. Narelle is from New South Wales in Australia and has been a service provider and an advocate for 27 years. She is the National Chairperson of Homelessness Australia, is a member of the Prime Minister's Council on Homelessness, and is the Chief Executive Officer of Southern Youth Family Services. She's also a member to the Order of Australia Award. Michael Coffey has been an advocate and activist for young people experiencing homelessness in Australia for over 20 years. For the last 10 years, Michael has been the Chief Executive Officer of the Youth Homelessness Organization in New South Wales, Y Foundation. Among other activities, Michael is also the chair of the National Youth Coalition for Housing and is the Secretary of Homelessness Australia. So, welcome to Narelle.
We are going to talk really quickly, so I hope you understand our accents. Thanks very much to Bruce and Sheldon and Rachel and also to Dallas who helped get us here and invited us. So it's been great to come here. And congratulations on all the good work that you do. We were very privileged to visit a number of services in Toronto and Montreal and here, and the hospitality has been amazing. So thank you very much to all of those services. We've also had good treatment by the taxi drivers, the restaurants we went to, the shops I've shopped in, and everybody. It has been incredibly helpful and positive. So I think you should be congratulated for your service industry as well. Come to Australia, I've been saying that everywhere I go. There is a homelessness conference in September that moves into our warmer part of the year, so have a holiday as well if your boss will let you off. And I can't promise you the taxi drivers will be as nice as the ones here. We do have some good seafood and some good sights to see. I'm not sure we can equal the screeching event or the kissing the cod thing, but we'll see. I want to congratulate you all, and particularly those who led that youth homelessness policy that was launched. We worry about people coming from other countries to tell you how to do it, so I had a few comments on the policy, so I'm going to keep them to myself and I'll share them with Sheldon and those later. But I think the policy is a great document and a good way forward for you, so well done. And I think also we've never met Steve before and we were a bit nervous, thinking, oh my God, what if we disagree? There'll be a fight on the panel. And I met Steve in the elevator, we had a quick catch up and we decided we're probably on the same page for almost everything. So I think do what he says and you're well on the way. But I'm going to probably say a few little things about where I don't agree and where our experience may enhance the understanding of that, so we'll get to those. We've already been introduced, so I don't think we need to tell you much more about us, except probably one of the differences in Australia is that we have probably a stronger funded advocacy and lobbying system. And so both of us, for all of our working career in the community services industry, have been part of paid, funded, and sometimes unfunded, but mostly funded peak organisations that can actually lead and help the advocacy. So perhaps that's why we're a tiny little bit further along, and we'll probably talk about that. Michael's got a whole lot of slides, so we'll talk to those very quickly as well. There are similarities with our country. Obviously, we speak about the same language. There are interesting similarities around our governments. We rely, all of us, on a committed community services industry workforce. Young people around the world, I've been fortunate to travel to many countries. Young people around the world have similar issues. We're all looking around the same sorts of things. You look at unemployment, youth incomes, power, discrimination, abuse, domestic and family violence. Those things are common. And so I think one of the things about the beauty of us being here and joining with you is we need to strongly join together around the international lobby around those things. I think the other commonality, and with all due respect to anybody who works in the government here, I'm sure there's great examples of good governance, but in many countries that I've been to, and Australia as a standout, some of the governance around funding community organisations and taking care of community organisations is completely and absolutely shitful, is a word in Australia. And, you know, we can talk about that. And community services share the same issues as well, so we'll probably touch on that. There are differences. I think some of the differences in regard to homelessness is we probably have a slightly different definition. We have a much broader definition which encompasses all those people who are at risk or vulnerable to homelessness, and that's absolutely part of that cultural definition. We do have a good data collection, a good evaluation system, and so we can help with some of that data experience perhaps. We have a different history about where we grew up, and we'll talk to that quickly. And also, I think we have a different relationship with our unions. We have a much stronger respect, I think, for unions and fighting for the workforce. And I think we've done much better around that because of that understanding our unions. And I tried to get a handle on the differences. Sheldon's given me a bit of an explanation. Some services said various things about unions, but again, we're happy to share that experience because unions for us also help the fight. We were asked to come and present about developments in Australia and about what we're doing. We do not want you to think we're like some other people who come and tell you, we think that we know everything, we want to tell you how to do it. We're not doing so good in some areas, we're all doing better, and we can chat about that. We don't have all the answers, but I think we're probably a little bit further along in the early intervention prevention area. And I think having said all of that, we might start the slides perhaps.
Yeah, I'm just going to go through and basically just go through some of the big numbers, some of the context, and tell a bit of the story about how we got to where we are in Australia at the moment. Then we're going to just have a bit of discussion around some opportunities that are around, some things we're worried about, and maybe briefly go to what we kind of learned in the process. So hopefully this works. So just the context in Australia, we've got 20 million people at the last census, but I think it's going to be about 24 million, not the census last year, so it's roughly about the same count, isn't it? The same population. About 6.3 million are under 25 years of age. We do a census count which indicates who are homeless, and the last estimation was 104,000 homeless people every night in Australia. And this is a bit of a breakdown of what the estimate for young people in Australia that are homeless. It's roughly nearly a half that population, so you can see kids of the age differences there. A lot of the younger ones, the 12,000 there are children who are with parents, women escaping domestic violence as well. So it's a pretty broad sweep of young people. Despite that big number, and despite what people say about Australia, 1 in 2 of requests for accommodation in existing services are turned away every day. So it means the demand for support housing is still not really met in Australia for a whole lot of reasons. We've also collected great data on who gets into the services, and there's 91,000 these people access services in a 3-month period to September 2011, and that shows you the breakdown of those people. So the significant youth population, I think it's about 43% of the people in homeless services are under 25 years of age. And that's the gender breakdown. So what's a bit different in Australia is there's a really high proportion of female young homeless people. So what do we mean by homelessness? To expand what Rob was talking about, this is our cultural definition of homelessness. I break into visible homeless. This is what generally policymakers think about, is the people who are sleeping rough. As you see, it's only 13% in Australia are actually as primary homeless, and you see where everybody else is. So we've got a pretty sophisticated definition of homelessness. There's a politics of definition counting going on at the moment. So there's a bit of a battle on this definition. We could find our policymakers focusing just on the primary visible place of homelessness. So where are they? That's kind of the breakdown of those people who are homeless in Australia, where they are. Again, not a great portion of them are sleeping rough. Only 90% are in specialist homelessness services. All the rest are in situations like couch surfing or places like boarding houses or intermittently sleeping rough. And these are the pathways into adult homelessness. There's a recent study that was done in Australia indicated that they did a sample of adults, chronic adults who are homeless, and 42% of those have been in state care and then gone through the youth homelessness system or not gone through the youth homelessness system. So that's significant. So when we think about youth homelessness, we actually have to think about more dynamically about what happens to them afterwards. And similar to what you presented before, these are the reasons why data tells us about why young people are homeless. Family breakdown, child abuse, family domestic violence, and no access to affordable housing and rents. But that's more for the older age group of young people, the 16 to 25-year-old. And underneath all of that is all the systemic stuff we're talking about. So it's not just a story of individual failure, it's a whole systems failures that contribute to the condition of homelessness. Same in Canada. There's a whole lot of barriers to pathways out of homelessness in Australia. And it's also a lack of affordable, secure housing, lack of access to paid employment, and also just access to any sort of income, I guess. Moral of that little story of data is there's still not enough stuff, there's not enough youth housing supports, there's not enough pathways, and there's not enough early interventions. Steve was saying before about changing that, shifting the resources, shifting the emphasis on early intervention and prevention. Sometimes that can get read by policymakers if you take the money out of the crisis services and whack it into early intervention. We just reckon there's not enough of everything. Yeah. Maybe in the long run it might mean a different emphasis on different parts of that. Before the 1970s, it's a bit of a backstory of where we got to. If you were homeless, a young person who's homeless in Australia, these are the sort of things you'd expect: big institutions, foster homes, juvenile detention, big charities and philanthropic organisations running homelessness services, and this is kind of what they look like. An inviting situation if you're a young homeless person, like a typical orphanage. That was your bedroom. That's a social enterprise. There's another social enterprise. A really atrocious thing in Australia is a whole lot of young people were taken away from Aboriginal families, so they became homeless, adult homeless. The other option, if you are a young person, was juvenile justice, and that's still the case in some parts of Australia. It becomes like a de facto homelessness system. There's no services there. So that's what we sort of, in the history of Australia, welfare, we started to rebel against that. A really significant thing happened in our country is this particular person got to become Prime Minister, and that's the moment in like the early 70s where everything kind of changed in Australia. We suddenly started having small NGO organisations getting funded. We had things like Medicare, free health benefits, and all those sorts of things became consequent to drop in power. And we've been very successful marching against Vietnam, all sorts of stuff, so to walk the streets and make youth homelessness an issue. And I'd like to just say that it's a real characteristic. I think it's the same in other countries too, that particularly in Australia, youth homelessness and homelessness has been a real public, we made it happen. It wasn't government that decided that youth homelessness was a problem. We made it a problem. We brought attention to it. And there's some examples of us doing that. Storming the streets, going to Parliament House, being really, really silly about ourselves, we're not taking it too serious, not taking ourselves too seriously, some other characteristics. And consequently, with all the action that we started making and with the divergence of the change in government, we started getting a lot of attention about youth homelessness in Australia, making a big press noise. And we made so much noise, we started getting funds for early versions of services. So the advocacy started to work, lobbying worked. In the 1970s, we started rebelling against those big institutions, and we had really small youth refuges started. So 4 to 6 sort of bed services, like homes. And this is an Narelle service, like the very, very, very early version, sort of tells you a little bit about how some of the thinking was at the time. So I actually have copies of the minutes of their first annual meeting and stuff. The first versions of their youth refuges are run by volunteer house parents. That's a shot from a TV show in Australia. You might get it if you can play my way. But it usually gets last in Australia. Not here. In the early 1980s, however, that sort of shifted from being a volunteer parents, house parents to being more professional paid youth workers. The volunteer part became involved in what community-based management, where they became on the boards of the small services that they had operation. And after considerable lobbying again, there was a whole lot of hodgepodge of fundings all around. We got consolidated into a national program called the Supported Accommodation Assistance Program, we call it SAP. That's established in 1985. The momentum of that program has continued past 2009. It's now part of the National Affordable Housing Agreement. And just to get an idea of the size, the program last year was just under $500 million across the country, and that funded 1,500 services. So about 35% of those are youth services. So that's about 500 youth services, youth homelessness services funded across the country. So it's been a really significant program for the country since 1985. It also had a legislation act too, which assured some national consistency. Because what happens in a country like Australia, you might have a really good idea at the Commonwealth level, but by the time it goes to the states and territories, it's changed and shape-shifted. The SAP, the act actually associated with SAP actually sort of ensured some sort of consistency, which was really, really good. We're a bit worried about it now though. Services were organised into 3 models at the time. It was mainly by contractual arrangements. It's not what people wanted to do, it's just the way they got funded. You had crisis services up to 3 months, medium-term services, which are kind of more lower intensive support, and then gradually to long-term scattered site sort of models. Now, since that time, the sector has been really reforming itself and shape-shifting since then along the lines. You've got things like FOIA models, hybrid integrated services, youth hubs, all the stuff that's there. You've got funded peak agency advocacy groups like ourselves, and you've got national homelessness plans. Case management became really, really prominent, so as the professionalisation from the house parent to the youth worker to the almost like the social worker and case manager, those sort of options have really grown. Reconnects emerge as well. We also, he was saying, we already know what to do. Way back in 1989, we had a thing called the Burdekin report, which basically did a really, really good scan of young people, services, and millions of recommendations came out of it. And it's still, after all these years, some of those recommendations are being acted on by government. But we know what to do. It ain't rocket science. Following on from the things that Bertha can report, though, we've got things like the Job Replacement Education JPEG program was established, but as you can see, that didn't have legislative act attached to it. So basically, despite its success, it was defunded, then we lobbied to get it refunded, and then got defunded, and got refunded, and consequently now it's been reshaped in such a way that young people aren't getting any access to this. What's it called, job?
Just to explain, it was the employment response for young people. It was an incredibly successful program, nationally funded. It provided job placement, work experience, mentoring. You could help set up jobs. It was a bit like social enterprise, but wasn't called that. Fantastic program. Connected to a youth accommodation service. Connect that to reconnect the early intervention response. You've started to get a better response for young homeless people. It was a very political program. So one government started it, the next one axed it. Then the next one started it again, and then they realised it was good, so they called it a different name, pretended it started again. And every time you do that, you know that you lose infrastructure, you lose momentum, you lose capacity, and you get a community that starts distrusting that kind of model. It's a really good model. What we've done now is we did do employment services reform. That was a good thing, but the casualty in that is they axed the youth program, and there is no youth specialist employment response. And if there's anything, and there's probably a few key messages today with funders, you absolutely need a nationally funded youth employment system connected to the homelessness system to make a difference. We're going back to try and get it again.
So again, all of those things weren't started by government. We lobbied for them to happen.
What I should say about the Reconnect program, which Steve alluded to, it is an early intervention program. It can have a bit of prevention, so it can do more community awareness, education, etc. But it is mainly an early intervention response. And it's a great program, nationally funded. It was significant new dollars. That came about after a very evil Prime Minister. I hope this isn't being recorded, if you might need to take it out. But he was a very evil Prime Minister, John Howard, and many of you will have heard his name. And he believed that many young people were running away from very happy, well-adjusted, stable homes, and they were ending up on the street because they were very naughty young people. And he called this great big task force to do something about that, to make all these kids go home. The unfortunate thing for him was they put me on it. I was the only non-traditional person on that committee. There were ministers and all sorts of things. And I found an ally in a man from the Salvation Army, David Eldridge, who actually was in an earlier photo. And we were able to turn that committee around, and everybody ended up understanding the evidence. In fact, that just wasn't true. It was absolute bullshit. That's another Australian word. And what happened then, although this man was an evil Prime Minister, he managed to understand what that committee was saying, and again we got a significant national program funded, and that has actually survived different governments. So Liberal and Labor, both our Conservative and so-called progressive governments support the early intervention response, which I think is one of the things that, although you're trying to do here and you understand the importance of it, you're struggling with around resources and time and how to do it. I think the Reconnect program is a really good model.
So again, we did there was another inquiry 20 years after that first one that Bertha went for, and you can see Narelle down in the corner there. She was one of the commissioners in this inquiry too. And this is in a nutshell what kind of the elements that they came up with, trying to happen, homelessness in Australia, prevention, or just basic, similar things to what you want.
There's a key piece of lobbying and advocacy around using national inquiries, particularly when they've got teeth. So the Human Rights and Equal Opportunity Commission has teeth in Australia. It did the first inquiry. This one had teeth because it was independently funded from government. So we were able to say the truth instead of feeling like you got briefed by government and you had to kind of suck up a bit and tell them which bits were good. You could say what bits were good, truthfully, and you could also say which bits were woeful and what else we had to do. So that inquiry actually is continually used now. There was a documentary that went with it.
So all these things kind of then converged, the work on inquiry, continued lobbying, and it sort of converged to a point where there was a change in the federal government in 2007, and we managed, for probably the first time in a very, very long time, probably 20, 30 years, to get homelessness up, not just as like something they would say on the side in a federal election, but it became one of the major issues. It became one of the big ticket items in the election. And the new Prime Minister, Kevin Rudd, and Tanya Plibersek, as a politician in Australia as well, wearing the right t-shirts and stuff. They elevated ending homelessness and youth homelessness to be a major priority for the government. They made all their new ministers, when they got sworn in, to go and visit a youth homelessness service, which is just in their local electorate and make the connection, which is fantastic. This resulted in, again, another political process where they actually did for the first time a national plan about homelessness too. It's called A Road Home, and this is kind of what it looks like. Again, it's similar idea. Do you want to say something?
No, I think I'm sure to hurry us up. So.
Yeah. I'm being more kind to my Australian friends. So
There's also chit chat over here.
Yeah, I think we're okay.
cool.
Basically the same sort of things you can sort of see: early intervention, prevention, called turning off the tap. So you can see all the words that we've been using morphing through the government bond and adopting them as a plan. These are kind of so ambiguous though, you can make them become improving and expanding services can be about a reform process. It can be about making services more cost effective. So there's a lot of wiggling room in these words as well. That's an Australian term. Wiggling room. They also set some targets for the first time. The SAP project never had, the SAP program never had targets, but they've got these things they picked up in America about halving homelessness by 2020. They're big bold statements. And they talked about first down payment of funds, focusing on rough sleepers and reducing homelessness. They put another $800 million, not billion dollars, into to fund about another 120 services over a 4-year period. On top of that, other $500 million talked about the 4 years. So significant investment.
Yeah, I think probably we should say there was some other money which made a significant difference. So under the bad thing was the economic financial crisis for most people in the world. For Australia, it gave us $5.6 billion into social housing stimulus funding. That was an amazing boost across our country. Now, that sounds fantastic, and it is. And so coupled with the homelessness strategy, there is evidence that we are starting to reduce it. There is evidence that we will meet the first target, which makes everybody really happy in government. They were very scared, and I have a secret report which government won't let us release yet, although I'm hoping in the next few days it'll be ticked off, which is a report card on where we've got to. The early evidence is it is starting to work. So it's early days, but I think that's fantastic. The other bit of money, so we've got $1.1 billion to a national partnership agreement on reducing homelessness for new initiatives to sit alongside everything else. Again, you've got to get new money. We've got $311 million for a thing called Place to Call Home, which is a bit like Housing First, but it meant that the Housing Authority had to provide some housing as well. And we got and the Reconnect program's worth $50 million recurrently across the country as well. So I think significant dollars in the first lot. They kept saying it was a down payment, and we all know what a down payment is. You make a down payment on your house, and you've got to keep paying the house off. Down payment to me means payment one. Yeah, now they're arguing about the next few payments. We're still working on the premise that it was a down payment, and we have to keep going. That stimulus funding for housing in Australia, I'm not sure of the numbers of stock here and the unit projections here, but we believe we need that stimulus funding repeated year after year for the next 20 years to actually catch up with housing stock to make it match housing weight. And so we need to keep that pressure on government.
So we can't rest in our laurels.
Yeah, I don't know if I can do this at the same time as talk. I'm not very, I'm a competent talker, not technologically competent. I'll do this really quickly. This is just an example of a service in Australia. Clearly it's the one I work in. I work in a large regional area 2 hours south of Sydney on the eastern coast, and we also do a tablelands area which has an Indigenous population as well as rural and remote. But it's quite a big geographical area. Our shelters, I pick up some tension in this country around some negativity about your existing emergency shelters. And I have to say, I'm much more positive about them. I think in Canada, they do a very hard job of very, very bad money. Poor money. I mean, that per day amount of money, that wouldn't get us through, it just wouldn't do it for us. And so there's a struggle. I do think some of them are too big. That would be a comment I'd have. We did a thing where we went to a much smaller size for emergency shelters. That costs more money though. Clearly the more beds you have, the cheaper the cost is long term. But, you know, go smaller, fight for the money, make them nice places to be, don't make them austere, be careful about them and treat them with respect, because the crisis workers, the emergency shelters, they're at the front line, you know, and they're a very important early identification source for people who are becoming at risk, particularly in regional and country areas. So if there was one thing I was going to say about the policy that I think is great, I think you need to lift up somehow the respect to emergency shelters, but think about how we can reform them to be better and safer places for staff and young people. That's one of our emergency shelters. Australia has warmer weather, at least compared to this coast, so we have a lot of outdoor area, and there's only 8 beds in this premises, 24-hour staff supported. That's the living room. We have a lot of living space. We invest in property, and I did go to some really good services in this country where they're obviously investing in good quality furniture, nice floorings, you know, everything that makes it nice. Where you'd be happy to go spend the night. Like the hotel. Why shouldn't it look like a nice hotel room when you first get there? Don't have a bare mattress. You know, make it up, make it look nice. You know, these poor kids are coming from some bloody horrible place. Make it nice for them. And that's our, it's a heritage building in the Tablelands. That's another emergency shelter for 6 young people. Sorry, I should say every young person that's in the pictures has given us written permission to show. They were quite excited that their pictures were going to be shown internationally, and they wondered if you could bring them over here. That's some of our transitional and medium-term accommodation. I totally support the need for transitional accommodation. Young people themselves are transitioning in their life. It's a part of their life. And so none of us, I don't believe any of us as adults, live in the same place we did when we were 18. We moved. You moved for all sorts of reasons. Give them the capacity and the opportunity. Transitional is important for young people. So is emergency, so is long term. Let them have the opportunity for a whole range of options. That's why you've got to have all the different models. I don't believe one model is the answer. Housing First is one model, it's a great model, it's not for everybody. Emergency shelters, great model, not for everybody. Long-term housing, great model, not for everybody. You know, be careful about thinking that you have the answer in a particular stream or model. And these are just some of the young people. One of the services for young women escaping violence, they can have their young babies there, it's quite a safe place. They can come and go as they please, there are staff there if they want it. I get confused about which building it is. That's one of our foyer buildings. It was a singles unit Department of Housing, public housing thing. It didn't work very well, it was very damaged, it was let run down. We took it over, we kind of pretended that we were offering a really good deal. We'll take this shitful property over for you and look after it. We got good deals right near our emergency shelter, just down the driveway. We did it up, they gave us money. You know, sorry for us, we're taking on a shitful property, and it turned into that. So we're really happy with that. Nearly all of our sites will also have a computer training room attached. So young people can do homework or resumes or work, or we can have training come in. It's part of the learning community. They're not made to do it, but there's, you know, nice encouragement about why you want to do it. We think education and gainful employment and training to get work is one of the ways out. One of the training rooms. That's one of our foyer properties. So again, it was an old public housing authority building. For us, it's great, you know, double brick, hard to vandalise. We put solid core doors in. We did all the things that save us money in the long term around looking after the property. And we also furnish it, basic furniture, that we give them a little leather lounge, we give them TV, we give them a double bed, we give them nice linen to start with, and then they can look after it. And they can take that furniture with them should they go somewhere else. But we ask them to look after it. We want to teach people to be good tenants, so we model that. And we model it, you know, who doesn't want a nice place with nice furniture? Who wants shitty furniture that breaks and is crap and isn't painted properly and looks shitty? You know, give them something nice. My view is we save a whole lot of money on vandalism. Another computer training unit in there. That's just some of the one-bedroom flats. So there's a variety of things they can have. They can have in the emergency shelters. Mostly they have their own bedroom and maybe 2 or 3 share a bathroom. In every other property they have their own bedroom, their own bathroom, their own exit, and most of them have a little lounge room or a bed sitting area as well. Again, just some examples of the sort of quality of property that we believe young people should have. We think it should be where they feel happy to invite their friends, there's no stigma attached. That's just like a unit anywhere in town that people, sometimes our young workers say we wish we could have something as nice as that. It's just another one of the one-bedroom units. We've also, as an organisation, and we never used to call ourselves a social enterprise, but as I hear people speak in this country, we were probably doing it 20 years ago. We did this very scary thing. We bought our first property. I worked out that the rent would be more than the cost of the loan. So we took a loan out with a bank, and my board, we were very scared, and everyone was very scared, I have to say. And I started going to bed worrying about, oh my God, what have I done? I have to go back to public service. And we paid, it was cheaper than the rent. So we paid it off quicker, we used that then mortgage, bought another property, and we now own a significant portfolio of property. We bought some old motels, I think you have motels here. We bought some old country motels, and that's one of them, and we knocked out walls, so a little motel unit became a one-bedroom flat. And kids living in care, we take a contract from the state government for children in care, and we tell the government we'll do it for you, but we want all control of decision making, so we take that too. So we take control and care, case management, and guardianship of the young people in care, and they start off somewhere like this. Staff on site, that one has a pool, it's in a country area. That's a communal area, but they have their own bedroom, bathroom, kitchenette. And our view is those young people in care are developing the skills, learning to pay rent, learning to look after themselves, have support and supervision, because most people here would not want their 15 or 14-year-old child out in the community in an outreach property with a worker popping in once a week. I think that's nonsense. And so they've got support there, but a little bit of independence to practice. And all of the young people that are leaving our care are leaving not to homelessness. They're leaving, they have their own unit, and mostly hopefully are studying or got jobs. And we've got a better success rate of kids leaving care. One of the ways to reduce homelessness, and that shocking figure of 40-something% of adult homelessness being in state care, is to make sure as they're leaving care, they're well set up. So that's what we're trying to do. Come and visit, you come swim in the pool. That's another view with the motel units. We gave them a little outdoor courtyard as well, so we added that on. They've got a private gate that they can let visitors in and out. They're secure and safe. We also have properties out in the community. Some we own, some we lease from the state housing authority. Some we lease from private landlords who we've sucked up to and made them nice to us, and they let us have them, and we honour the rent. And they're little houses with young families, maybe a couple, those sorts of, they can live anywhere in the community, and they look like any other house in Australia. That's one we built. That is a duplex, so two bedroom units, shared driveway, and we put young people in there, have mental health issues, but they have intensive support going on. They are people who have mental health issues, but they're being treated now, and they want the support, and they voluntarily receive the support, so they're living somewhere really lovely. Sheldon just looked at his watch, but so you probably have worked out I'm quite civilly disobedient, and I support civil disobedience, so I'm just going to keep going and ignoring it. And this is our health service that was built by young unemployed people. It's on a local council land, but the property was paid for literally by our service and other services, and gave young people jobs. And then the council thought they might take that land back off us, though they're not bloody dead bodies. And so we fought and lobbied and carried on, and we refused to pay anything, and we became very civilly disobedient. They gave in, and we have that property now. They're just some of the young people. We do a lot with refugees. We have a lot of African refugees. I'm sure you have the same issues. I was intrigued to learn about Toronto and the diversity of the population there. Australia has a lot of Asian communities coming to our country, but also African just some young people. We have a very strong focus of young people being educated, training, finishing school as part and parcel of just what you do. It's a bit like Steve said, his house is a foyer, so is probably every family home. Why not try and replicate what really happens? Sometimes client self-determination and empowerment gets interpreted wrongly. Young people need encouragement. Get out of bed. I wouldn't have got out of bed and gone to school except my mum and dad made me. We make them get out of bed. We make them go and do something. And, we've got to be normal about what we do and stop pretending that we're something different to the rest of the community. We have a very strong partnership with our public technical college, and they provide They provide free training for us. At one point we had to pay for it, but now we don't. So we're going to move really quickly. I'm probably going to keep talking. Michael can just butt in. Lots of positives about Australia. That service we just showed you is where we want to get a lot of services moved to. So some have. Many have joined out-of-home care, child protection, employment, education, training, health services, outreach support, brokerage services, financial counselling, early intervention, treatment services, all in the one organisation or in a network of agencies that work really well together, and I think that's going much better. In terms of opportunities, come back there first. So, what? We usually work quite well together, what do you know? Oh no, just ignore him. Just go quickly back. I'll just quickly. We came a long way. We can do what we like. And we're leaving. Just really quickly, in terms of the strengths, I said the data collection, we are building an evidence base. Government, don't get sucked into partnerships too easily. Partnerships are great, and work with government, and I did talk to Sean earlier. Of course it's better to work with them and talk to them and get them on side and have them be your ambassadors. But when they're not doing the right thing, say it, speak up. You have to be a little bit civil to be disobedient at times. Things are not right here yet, so you've got great partnerships, but things aren't right yet. So there's a long way to go. Don't forget, one of your jobs is about being an advocate and a lobbyist. That's why you're in the community services industry. You wanted to be part of government, you go work in the bureaucracy. So remember who you are. You are a little bit different. You have power in our community, and you've got to use that a little bit more strongly. I think that I was talking about stimulus funding, talking about, well, that's probably fine. One of the things that happened in Australia is, again, our connection with unions. We've just won a national court case for pay equity for all community workers, and not just good services that look after their staff, but for every service. Over 8 years now, federal government's just given us $2 billion to help with the wages for people across our country, to build wages to the point that they are equal to government salaries for similar jobs. So for some people, we won 47% pay increase for some workers. Don't forget how important unions can be to building capacity in this sector. Why shouldn't community sector workers earn the same as government people doing the same jobs? So don't forget that, and think about your attitude to the union and work out, maybe your union needs to be fixed, I don't know. But there's something about joining with them. Lots of worries in our state, so we're doing all right. Early intervention, we're doing okay, and we're happy to share that and learn about that program and how to help you get a national program here. We worry that government have started to take control of the agenda because there's targets, which I think are great. They make government be honest. We've got data collection, that's great. But government are now getting scared, we're going to look like shit, and so they're trying to take control of it, and they're trying to go get rid of all your crisis shelters and you can just move all the money to outreach. But you cannot pull young people. So we've got to keep fighting that. So we've got to worry about government thinking it knows everything, and it doesn't. Working together, maybe. Mainstream services, I think everybody mentioned that, still we haven't properly got. In the white paper it says mainstream services must engage with the homelessness sector. It doesn't actually say what it's got to deliver, and there's not really many targets about that. So we need to fix that, and somehow that's been misinterpreted now that homelessness services have to engage with mainstream services. So it's been turned around a bit. We need to keep fighting that. You've got to have health on board. You've got to have your housing public authority on board. You've got to have public income security for people. So, we probably picked up most of those, I think, in chatting. And I understand very clearly that I'm at a conference where many people are housing associations and housing services. Have to be really careful that in the UK, some of those are struggling now, and housing associations are not the only sort of community organisation that should grow and develop and be supported. And housing associations, I would caution them not to think you're the ones that should have to do everything. Work out who else is doing good things in the community and just join with them. Don't think you're the only ones who should own property. Don't think you're the only ones who have the answer for housing. So, remember that there's a big wide sector out there. I don't agree about the one thing where Steve and I will disagree. I'm happy to talk about it. Is the one-stop shop assessment referral crisis sort of a system? I think it's rubbish. I think if you don't live in a capital city, it's not going to work. You know, can you imagine how you're going to do a 24-hour assessment referral centre in the, and I'll say we say out in the bush, it's called whoop whoop, you know. It's not going to work, you're going to laugh at you. So, you know, don't take it out there. Don't give it to the Indigenous communities. They're going to laugh at you as well. Already terrible things in Australia are happening to our Indigenous communities. You don't need a 24-hour one-stop assessment. So you need to make sure the system's working, that, you know, locally people need to be able to access the service they want to. You need to have good information. That service needs to know how to assess and refer out and prevent people getting in. But I think spending money on a big assessment centre in whatever way you do it is rubbish. We need more funding for youth services. Is that really it, Michael? Are you really there? Is that the last time?
Oh yeah. Just a general comment is, we're noticing in Australia is that the government's talking about reform, rethinking innovation, new models, integration, joint up services, housing first, but they all have different understandings about what that actually means, and they just use the words, they actually don't really match the original meanings of those words. So just be really careful. That's our experience. When you say housing first approach, everybody in Australia says housing first approach, because they mean entirely different things.
I think the other is don't let go. I think I've said it, I'm going to say it again. And I think a couple of the keynote speakers said, and particularly the two fellas, I think are from Montreal, the French-speaking presentation, don't let them off the hook. They're quite correct. We can get quartered into thinking that we need to take over what government does, and you must not do that, or you will never prevent it, and you'll certainly never fix it. I think you've also got to be really careful of things like social bonds. Yeah, look at it, let's work out where they're useful, but they are not going to work in some of the areas we work in. It's actually a nonsense. Remember that at the end of the day, most people in the private sector are in the private sector because they want to make a profit. Somewhere along the line, profit has to be made, return has to be made. And in Australia, we've started privatising some prisons. And the treatment in those prisons is woeful and disgusting, because how do you make money if you're a private agency run the prison? You reduce the support in the prison. You reduce what they say is non-essential services. That's not the way to do it. Our child protection, we have a national framework for fixing child protection. Not there yet, but the framework is good, so I think we can share that with you. And I think we are doing better in some states and territories around children in care. Lots of people blame the care system. I do, you know, I think the care system is pretty horrible in many states and territories, in many countries. But remember, those young people and children didn't come from a good place in the first place. So that system itself is working in deficit and then not doing so good, and so we get double deficit, really. Young people in care, we must do something about that, because then we can reduce adult homelessness, and in terms of early intervention, that's where you start. So we need to be careful about what we think about early intervention as well.
So I'm going to say one last thing, because we've got to finish up now. Basically, the message I want to be clear today is that we wouldn't have what we have in Australia in terms of youth homelessness services if we hadn't made a big noise about it. So we encourage you not to be introverted about this, be extroverted, and let everybody know about it. And what's really useful is the sector has a voice that we speak and we advocate. It's also really good that we've actually had governments that have prepared to listen. So we've been fortunate in that respect.
And I fly by Qantas, and Qantas are very strict about luggage, and I have far too much. So I have all these handouts over there, and some bags and stuff. So you've got to take them. I'm not asking, I'm just telling them. You've got to take them, otherwise Qantas is going to have shit. And if anybody doesn't get, because it's not enough for everybody, but if there's something you want that's not there, give me your name and email, and I'll work out, and your address, and we'll work out how to post it or get it to you. Come to Australia, there's a conference in September. We would love to see some, and we'll organise tours and all sorts of things. Please come.
Thank you very much to Michael and Narelle. So I guess the only thing I can think of is, even if I was inclined to disagree with Michael and Narelle, which I clearly not, I'm not brave enough. just as wonderful the second time around, so thank you very much. One of the things I will say that I guess impressed me the first time around and the second time around is at a variety of different levels and a variety of different ways in the community and government, there's national leadership, which means there's a plan. And even though there are times where you might not agree with all of the plan or not all of the plan is working the way it's supposed to, there is at least. How do you ever go anywhere if you don't have that? So the fact that there's leaders in the community, in government, people willing to listen and talk to each other, I think is the key. And I think that's one of the things in terms of where we're going, the conversations that we've seen here at this conference, the national policy statement, is we're moving in a direction where people are actually starting to lift up the issue, moving to the front of the stage, as Maria said, the hallway down, 3 doors to the left. There's a lot of work to be done, but we're starting to head in the right direction. So I hear that message loud, so thank you very much. One of the other things I'd like to do before we go, and I'm sure we don't have a lot of questions, so I'd certainly encourage people to maybe approach these people individually. They're very nice people. I'm sure they'd love to chat to you, after the session is over. I'd like to get a nod to, at some point, the definition of homelessness was kind of a theme here. I'm happy to report that coming soon to a theater near you is a new national, much more articulated definition of homelessness, compliments of the Canadian Homelessness Research Network, which will be released soon after you, Steve. So that's I think another piece of the puzzle. So with that, that's the end of our session. Again, feel free to approach these folks and have a chat. Thank you very much.